Shawna is up next, Shawna Pandya. She will talk about her work with space health topics from the physician-surgeon perspective. I saw you come in, Shawna. You can unmute yourself and then the floor is yours.
Can everyone hear me okay?
Yes, perfectly, thanks.
Perfect, thanks so much for having me. So I'm going to try sharing my screen and we'll see how that works.
There's a big green button at the bottom of the screen that you can use for that.
Perfect, can you guys see?
It's initiating?
Yes, there it is.
Perfect. All right, so thank you so much for having me. My name is Dr. Shawna Pandya. I am a physician, surgeon, citizen scientist, astronaut candidate. So and my areas of research entail space spin-off technologies, spin-in and spin-out, which we'll be talking about today, psychological resilience in long-duration spaceflight, logistics of reproduction, and sexuality in long-duration spaceflight. And then a previous area of research has been on NeuroArm, a neurosurgical robot based off Canadarm Technologies, which is a perfect example of a spin-off that has been brought to terrestrial medicine. So my hopes for you are to give you an idea of what space spin-in, spin-off technologies entail, why we care about them, taking a step back at the bigger picture, looking at how this frames innovation, how this can be a two-way street between spin-in and spin-off, and then how this might be applied to the exponential community, exponential thinking, and then talking about opportunities for collaboration. So I know time is short, so we'll get going. So when you look at places like the International Space Station, a remote village in Africa or India, the Arctic, the Antarctic, and the Aquarius Reef Research Base, what do all of these locales have in common? And the answer is that they're all remote, resource limited, and constrained. They're all extreme environments, and they're perfect locales in which to practice extreme environment medicine. The upside of that is they're excellent drivers of technology and innovation. So focusing on a second solely on space medicine, if you remember anything about space, is that space is trying to kill you. The environment is extremely hostile. So between microgravity, increased radiation exposure, disrupted circadian rhythms, if you're on the International Space Station, you'll experience sunset sunrise every 90 minutes, so 16 every 24 hours. You're in a constrained space. There's lots of vibration, lots of noise, and it's not easy to get access to medical care. It's not immediate, so you're pretty constrained. Speaking specifically to microgravity itself, this leads to muscle atrophy, decreased bone density and bone loss, fluid shifts, including increased cardiac fluid load, congestion, increased intracranial pressure and intraocular pressure. So it's not as fun as it can seem being in space. There's a lot of medical considerations. So any technology that is involved with operational space medicine needs to be portable. It needs to be lightweight. It costs about $10,000 US per kilogram to transport something to space, including launch costs. It needs to be hardy, especially when you're in a high radiation environment, and it needs to be accurate. So as you can imagine, the space environment is a great breeding ground and driver for innovation. So let's talk a little bit about spin-in, spin-off technologies. What I'm going to talk to you next is based on one of the book chapters I've written on the subject called From Orbit to OR, Space Solutions for Terrestrial Challenges in Medicine. So to give you a broad overview, when we talk about constraints it's not specific to the space environment. And a lot of good has come out of the space program. We often get people questioning why explore space, why spend so much money on the space program when there's so many problems on Earth that need to be addressed. And to be fair, it's not a false dichotomy. A lot of benefit from being able to provide portable, lightweight solutions in space have benefit on Earth. And to take you through the images here on this slide, in the top left corner, we have portable iodine resin water filters that have been used on the International Space Station, or the ISS, that have been spun off for remote villages in Kenya, I believe it is. In the middle on top there, you can see portable handheld ultrasound developed for the ISS that's now being used for prenatal and antenatal care in Inuit populations in Canada. The kids who look pretty happy there with the space blanket on their heads are using a thermal blanket with 97% reflectivity that was, again, developed for space. Coming to the bottom row, lightweight portable deployable antennas that can bring comms to areas that would otherwise have none, so perfect for disaster situations. Air scrubbers to keep the atmosphere clean, and portable on the ISS have been used to increase the longevity of produce during transport and increase the air quality in doctors' and surgeons' offices. And then in that last panel there, down on the bottom right, portable refrigerators have allowed us to increase the longevity of vaccines in areas where refrigeration and electricity is otherwise not available. So I'm going to spend the next couple of slides focusing on specific areas of spin-off in medicine. So looking at diagnostics, imaging, and treatment, there are numerous examples, and one of my favorite examples is charge-coupled devices on the Hubble telescope have actually been spun off to increase resolution for mammography and breast cancer screening. When it comes to treatment and care, some of the same materials and same telemetry that has been used for on board the space station has also been used to develop better pacemakers, alternatives in angioplasty, and even electrical stimulation for pain management, which was initially used to see if it could prevent muscle atrophy aboard the ISS in microgravity. Switching over to public health, safety, and research, the examples are numerous. And the fireproof paint that has been used aboard launch vehicles has also been spun off to the Indy 500 and professional car racing to be used on those cars. Insulation on spacesuits has been spun off for Arctic wear. And even for improving brakes, it's one of the examples of spin-off technologies from the space sector. And as much as we know about space, there's a lot of questions to be answered about what exactly the long duration effects of space are on, and the microgravity environment are on the human body. And it's particularly relevant with private and public entities like NASA, like SpaceX, proposing to go to Mars, proposing to colonize Mars, when we don't even know what the minimum gravity prescription is to survive long-term in space. Is 1/3 gravity on Mars, is that enough? Is 1/6 gravity on the moon enough? Because we just don't know at this point. What we do know from our research is that bone loss is a big concern in microgravity, and that research has fueled osteoporosis studies here on Earth. Aging, immunity, decompensation, so orthostatic hypotension when astronauts return to Earth, when the blood pools back in the feet and astronauts still see them being carried out of their spacecraft. They're unable to walk because they're so decompensated. That's field research back on Earth. So as you can see, there's actually a lot of overlap. So it's not this false dichotomy of let's spend money on space or let's spend money on terrestrial medicine and research related to that. They actually fuel one another. Telemedicine is another great example. So we talked a little bit about NeuroArm, one of the projects I worked on. So Canadarm is that big robotic arm outside the International Space Station, and the same company, MDA Robotics, that helped or that built Canadarm also was involved with the making of NeuroArm. And that was spun off to make this robot that can do brain surgery, that is MRI compatible, filters out vibration, can lock its axis, and work on a millimeter scale and micrometer scale compared to the human hand. So that's just one example of telemedicine. Examples in dermatology, teleradiology, portable blood analyzers used aboard the ISS are being used here on Earth. So I hope to convince you that there is a lot of areas of overlap when it comes to spin-off. I want to talk a little bit now about the opportunities in space medicine for spin-in and spin-off. So from the examples, I hope to have convinced you that there's a lot of benefit to come from the space world to terrestrial medicine, both for the developed world and the developing world. But there's also a lot of opportunity for spin-in. So there's a lot, and when we talk about the drivers, we talked about the constrained environment, the mass and resource and volume limited environment, but we also look at the drivers. So this is where the innovation aspect comes in. We look at probabilities. What is the probability of X medical condition occurring? What is the risk if it happens? If it's a very remote but very high risk medical complication that occur, it's more likely to be considered and mitigated against than something that's very low risk and low probability. How simple is this innovation to use? And then what are our constraints? So we talked about in space, you're limited by what you can transport, by the mass, the costs of launching per kilogram, and also by the volume that you have to store things. So how this all ties into innovation and thinking exponentially is there's a lot of room, there's a lot of questions to be answered, there's a lot of room for collaboration, a lot of room for innovation, a lot of room for creating portable technologies that are equally important in any extreme environment, any resource-limited environment. And as a side benefit for those who might question why we do space exploration, there's an increased awareness of space technologies. So I hope to have given you a good overview. Happy to talk about collaboration opportunities with the various citizen scientist astronautic projects I'm involved with. So briefly, they're called Project Possum, Phenom, Association of Spaceflight Professionals, Untethered Exploration, and Final Frontier Designs. So if you have ideas of technologies you want to work on deploying or collaborating or testing in a remote environment like a Mars analog situation, I'm happy to chat further. I know I'm out of time now. I do have to run back to clinic right now, but really happy to talk offline. So my contact information is here, shawnapandya@gmail.com and at Shawna Pandya on social media.
Thank you, Shawna, for that fantastic talk from the medical perspective and translating the extreme environment to the need for novel technologies that benefit space health and Earth's healthcare too. And also thanks for taking the time in between your patient care schedule. That's fantastic, and I'm sure people will contact you. Thanks.